This bill will make a real difference and save lives throughout Massachusetts.
A significant policy change in Massachusetts to improve access to care and make cancer care more equitable.
We're really grateful to the Massachusetts legislature and Governor Healey for enacting the breast cancer equity and early detection legislation.
Massachusetts Governor Maura Healey signed into law an act relative to medically necessary breast screenings and exams for equity and early detection. Dana-Farber Cancer Institute advocated strongly for the passage of this legislation.
We know that screening mammography decreases mortality from breast cancer.
The law means insurers regulated by the Commonwealth must cover not just the initial screening mammogram, but also any follow-up screening with no out-of-pocket costs for patients with abnormal mammograms or dense breast tissue.
Let's say I have a mammogram and it comes back and it has an abnormality and I need to go back in and get an ultrasound or a mammogram that has an additional several $100s of cost with it. If I don't have the financial means to pay for that, obviously I'm not going to follow up with that, and that just means that this cancer that may be there is not getting diagnosed.
Dr. Sarah Talani, chief of the Division of Breast Oncology at Dana-Farber, says disparities in cancer outcomes are stark, particularly in underserved communities where access to appropriate screenings is limited.
There's a 40% higher mortality from breast cancer in a Black patient compared to their white patient counterpart. And so we need to do better.
The hope is this new law eliminates some of the barriers to care, making screening more equitable and saving more lives.
This bill will remove that financial barrier to follow-up tests. That will decrease disparities. It will improve the efficient diagnosis of breast cancer at an earlier stage where outcomes are better, and it will save lives.